Hi, my name is Tatiana Harrison, and my presentation today will be about genetically modified babies. A designer baby, a human embryo that has been genetically modified, following guidelines set by the parents or scientists to achieve desirable traits. Examples of these desirable traits are voice pitch, high intelligence, and increased muscle mass. There are two methods that are being used to create a designer baby. The first method, gene therapy, the delivery of polymers into a patient's cell as a drug to treat diseases. The second method, pre-implantation genetic diagnosis, PGD, the genetic profiling of embryos prior to implantation, and sometimes even prior to fertilization. This technology has been the subject of ethical debate, bringing up the idea of replacing humans with superhumans. The first attempt of modifying human DNA was done by Martin Klein in 1980. But the first successful gene transfer was done in 1989. I am personally against this idea for several reasons. The first of these reasons is that a gap in society could be created. This could create classes that distinguish between designer babies and regular humans. This practice could also lead to a lack of genetic diversity, as most people will opt for a good-looking and intelligent baby. A lack of genetic diversity has been shown to lead to further genetic problems. An embryo cannot consent to having its body altered. Therefore, the possible violation of human rights is an issue that may arise. Genes often have more than one use. Therefore, altering a gene could have adverse effects. For example, the gene that controls your intelligence could also control anger management. So you would end up with a baby with higher intelligence, but with serious anger issues. Genetically modifying a child is very expensive, so persons who are interested may not have the proper funding. Current techniques of genetic modification introduce genes at random places in the genome, which could disrupt the function of another gene which is crucial for survival. There is also a large room for error, as geneticists aren't perfect. The risks of genetically modifying a baby are too much at this point, and so it would be best to give it more thought before establishing it on the scientific market.